Today we're delving into Parkinson's disease, a progressive neurological disorder that primarily affects movement. As we age, understanding the early signs of such diseases becomes especially vital. After 50, our bodies undergo significant changes, making it all the more important to pay attention to symptoms that could indicate the onset of Parkinson's. Why focus on these early symptoms? Because early detection can dramatically influence management of the disease. Recognizing these signs not only empowers you, but also positions you to take proactive steps in managing health outcomes. If you or someone you love are noticing subtle changes in movement, coordination, or mood, it might be more than just aging. We encourage everyone watching to consider these symptoms as not just information, but a call to action. If these symptoms resonate with you, please see a healthcare professional. It's not just about getting a diagnosis, it's about getting the support and care you need and deserve. Remember, you're not alone in this, whether you're in the United States or anywhere else in the world. There are communities and professionals dedicated to helping. Stay informed, stay supportive, and let's tackle Parkinson's disease together. Symptom number 1, tremor. One of the earliest and most recognizable symptoms of Parkinson's disease is the tremor. This isn't just any tremor, it's a specific kind of shaking that typically starts in a limb, most often observed in the hand or fingers. Imagine holding your hand out to receive something and noticing a slight involuntary trembling, or seeing your fingers move rhythmically without your conscious control. This is what many face when encountering the initial stages of Parkinson's. This tremor is described as mild but persistent. It isn't a fleeting occurrence. Rather, it is a constant presence that subtly begins to affect daily activities. The tremor is particularly noticeable when the limb is at rest, hence its medical label as a resting tremor. For instance, you might notice it most when your hands are lying on your lap, or when you are sitting still watching television. It's less about the intensity of the shaking and more about its persistence and timing. Understanding this symptom is crucial because its early recognition can be a key factor in diagnosing Parkinson's disease. Many might dismiss it as mere nervousness or a temporary ailment, but its persistence is a signal that something more significant may be affecting the neurological pathways. The reason behind this tremor involves the malfunctioning of certain brain areas that control movement. As these areas become more affected, the control over voluntary movements diminishes, leading to the characteristic shaking. If you or someone you know begins to experience such symptoms, it's important not to dismiss them. Observing this tremor, particularly a tremor that occurs during rest, should prompt a consultation with a healthcare provider. Symptom number 2, slowed movement, bradykinesia. One of the most impactful symptoms of Parkinson's disease is bradykinesia, or slowed movement, which deeply affects the ability to carry out everyday tasks. This symptom manifests subtly but gradually intensifies, making routine activities increasingly difficult and time-consuming. Bradykinesia can transform simple actions that were once performed quickly and effortlessly into slow, laborious efforts. For instance, individuals might notice that their movements are not only slower, but also less precise. Walking, a mundane task, becomes a conscious effort, where steps become shorter and less assured. This change in gait can also be accompanied by a reduced arm swing, adding to an overall stiffness in movement. Moreover, tasks that require fine motor skills, such as buttoning a shirt or typing, become frustratingly difficult. The fingers seem to move against a resistance they can't see, turning what should be easy into a painstaking process. Even getting out of a chair can represent a challenge. What was once a fluid motion, pushing off and standing up, now requires more effort and time, as if every movement through air feels like wading through water. This deceleration in movement is more than an inconvenience. It's a significant barrier to maintaining independence, and can lead to feelings of frustration or helplessness. It is essential for those experiencing such changes to consult a healthcare professional. Symptom number 3, rigid muscles. Muscle rigidity is a common symptom of Parkinson's disease, affecting individuals in a way that profoundly impacts their physical capabilities and comfort. This rigidity or stiffness can occur in any part of the body, including the arms, legs, torso, or neck. Unlike normal stiffness that might follow exercise or a lack of movement, this stiffness is persistent and can be debilitating. The rigidity associated with Parkinson's disease is characterized by a constant, even resistance to movement in the muscles. It's as if the muscles are always tense, never fully relaxing, which can make even basic movements feel strenuous. This continuous muscle tension not only limits the range of motion, but can also lead to significant discomfort and pain. Activities that were once performed with ease, like turning over in bed or reaching for an item on a high shelf, become laborious tasks that require considerable effort and planning. The pain from this stiffness is not just due to muscle tension, but also arises from the strain it places on joints. As muscles remain tight, they can pull on the joints they are connected to, leading to aches that may persist even during periods of rest. Over time, this rigidity can lead to a decrease in physical activity, which may exacerbate other symptoms of Parkinson's and contribute to a decline in overall health. Symptom number 4, impaired posture and balance. Impaired posture and balance are significant symptoms of Parkinson's disease that often become more pronounced as the condition progresses. These changes can have a profound impact on daily activities and overall safety. One of the hallmark postural changes seen in Parkinson's disease is a stooped posture. Individuals may develop a forward bend in the spine, which is often subtle at first but can become more noticeable over time. This stooping can exacerbate other symptoms, such as difficulty walking or maintaining balance. The altered posture also shifts the center of gravity forward, which significantly increases the risk of falls. Balance issues are another critical concern for those with Parkinson's. These aren't just occasional missteps. They're a persistent vulnerability that affects stability even in familiar settings. The normal reflexes that help adjust posture to maintain balance become impaired, making it difficult for someone with Parkinson's to quickly correct their stance if they start to fall. This impairment can lead to more frequent falls, which can be particularly dangerous for older adults, potentially resulting in serious injuries. These changes in posture and balance can erode the confidence required to move freely, leading to reduced activity levels and social withdrawal. It's crucial for individuals experiencing these symptoms to address them with healthcare providers who can offer strategies and therapies to help manage them. Physical therapy, for instance, can be particularly effective in improving posture and enhancing balance. This proactive approach not only helps in maintaining physical health, but also boosts psychological well-being by fostering greater independence and confidence in daily activities. Symptom number 5, loss of automatic movements. Loss of automatic movements is a subtle yet deeply impactful symptom of Parkinson's disease, which affects the natural ease with which the body performs routine actions. These automatic movements, such as blinking, smiling, and the natural arm swing while walking, are typically performed without conscious thought in healthy individuals. However, in Parkinson's disease, patients often must intentionally initiate these actions, which can be both exhausting and disconcerting. In the case of blinking, individuals with Parkinson's may find that they blink less frequently, which can lead to eye discomfort and problems with tear production. This seemingly minor change can significantly affect quality of life, causing irritation and distracting from tasks that require visual focus. Similarly, the loss of spontaneous smiling can have profound social implications. A smile is a universal sign of warmth and engagement, and the inability to smile automatically can make social interactions feel awkward and strained. This can be misinterpreted by others as a lack of interest or emotion, which is particularly distressing in social settings. The natural swing of the arms while walking is another automatic movement that is often diminished. Normally, arm swinging helps maintain balance and momentum. However, when this diminishes, it can contribute to the overall stiffness and imbalance that are characteristic of Parkinson's. The resulting rigidity can make walking appear more laborious and less fluid, further affecting mobility. Therapeutic interventions, such as physical therapy and exercises specifically designed to enhance motor function, can help patients regain some control over these automatic movements. These therapies are crucial as they focus not only on improving physical capabilities, but also on restoring some of the unconscious actions that contribute significantly to natural body language and emotional expression. Addressing these changes early can help maintain personal interactions and overall quality of life for those with Parkinson's disease. Symptom number 6, speech changes. Speech changes are a prominent symptom of Parkinson's disease, often affecting how individuals communicate and interact with others. These alterations in speech can take various forms, each impacting the clarity and effectiveness of verbal communication. One common change is the softening of the voice. Individuals with Parkinson's may notice that their voice has become much quieter, making it difficult for others to hear them. This softening occurs because the disease affects the muscles that control vocal cords, reducing their ability to vibrate effectively and produce sound. Another change is the speed of speech. Some may speak more quickly than before, a condition known as tachylalia or cluttering, which can make their speech difficult to understand. Words may come out in a rush, often jumbled together or slurred. This slurring happens as muscle rigidity and bradykinesia, the slowing of movement, extend to the muscles involved in articulation. Hesitation before speaking is also common. Individuals might pause frequently, struggling to get words out. This hesitation can be mistaken for uncertainty or confusion, but is typically a result of the difficulty in initiating the muscle movements necessary for speech. Additionally, there are pronounced changes in how words are articulated. Pronunciation may become less distinct as controlling the tongue and lip movements becomes more challenging. This can lead to misunderstandings and frustration in conversations, as listeners may find it hard to interpret what is being said. These speech changes are not only frustrating for the individual, but can also affect social interactions, potentially leading to withdrawal and isolation. Speech therapy is a crucial intervention that can help individuals with Parkinson's maintain as much normalcy in speech as possible. Therapists can provide exercises to strengthen the muscles involved in speech, teach strategies to control speech pace, and help maintain volume and clarity of speech. Such therapies are vital for improving life quality and helping individuals stay connected with others. Symptom number 7, writing changes. Writing changes, particularly the phenomenon known as micrographia, are common in Parkinson's disease. This symptom involves a noticeable decrease in handwriting size and the speed at which one can write, which can significantly affect an individual's ability to communicate in written form. Micrographia results in writing that appears much smaller than usual. As an individual writes, the letters may start at a normal size, but they tend to get progressively smaller and more cramped. This change is not merely a stylistic variation, it stems from the same motor control issues that affect other physical movements in Parkinson's disease. The muscle stiffness, slowed movement, and reduced fine motor coordination that affect the limbs and speech also impact the hands and fingers in similar ways. Writing not only becomes smaller, it also becomes more laborious and time-consuming. Those with Parkinson's often experience difficulty even initiating the process of writing. Holding a pen or pencil tightly enough to maintain control, but not so tight as to cause cramping, becomes a delicate balance. The act of writing, once fluid and automatic, turns into a slow, strenuous effort, requiring more conscious thought and physical exertion. Furthermore, the physical act of writing can become physically uncomfortable due to the increased rigidity and tremors in the hands and arms. This discomfort can discourage individuals from writing, potentially impacting their personal and professional lives, especially in situations where written communication is essential. Early recognition of changes in writing can be crucial for diagnosis and management of Parkinson's disease. Occupational therapy can be particularly beneficial, providing strategies and adaptive tools to assist with writing. Techniques to enhance motor control and exercises designed to improve hand strength and dexterity can help manage this symptom, making writing easier and less frustrating. Addressing these changes proactively can help maintain independence and quality of life for those affected by Parkinson's disease. Symptom number 8, decreased ability to smell. Decreased ability to smell, known medically as hyposmia, is one of the early warning signs of Parkinson's disease, though it is often overlooked because it can occur several years before other motor symptoms become apparent. This reduction in olfactory function can significantly affect an individual's ability to enjoy food and beverages and may compromise their safety, such as not being able to smell smoke from a fire. Individuals with Parkinson's might first notice that foods no longer taste as flavorful as before. This is because our sense of taste is heavily reliant on our sense of smell. When the ability to smell diminishes, foods may seem bland or lose their distinct flavors, leading to less enjoyment during meals and potentially affecting nutritional intake. Moreover, the difficulty in recognizing different odors extends beyond the dining table. It can include failing to detect body odor, environmental odors like gas leaks, or the scents of pets and nature. This loss can have profound implications for personal hygiene and overall quality of life, making it a subtle yet impactful symptom. The olfactory dysfunction in Parkinson's disease is believed to be due to the degeneration of certain brain areas responsible for processing smells. Detecting this symptom early on can be crucial for the diagnosis of Parkinson's, as it often precedes most motor symptoms. Awareness of this symptom can help individuals seek medical advice sooner. Neurologists may use smell tests as part of the diagnostic process for Parkinson's disease, although there is currently no cure to restore the sense of smell. Understanding and acknowledging this loss early can help individuals and their families adjust daily routines and safety precautions to better accommodate the sensory change. Symptom number 9, sleep problems. Sleep problems are a prevalent and disruptive symptom of Parkinson's disease, impacting the overall quality of life and daytime functioning. Individuals with Parkinson's often experience a range of sleep-related issues, each contributing to increased fatigue and affecting cognitive and physical performance during the day. One of the most notable sleep disturbances in Parkinson's is the occurrence of sudden movements during sleep. These are often abrupt and can include jerking or twitching of the limbs, known medically as sleep-related movement disorders, such as periodic limb movement disorder, PLMD. These involuntary movements can lead to frequent awakenings and significantly disrupt the sleep cycle. For partners or roommates, these movements can also disturb their rest, impacting the well-being of more than just the affected individual. Trouble falling asleep or staying asleep, known as insomnia, is another common issue. People with Parkinson's may spend hours tossing and turning, struggling to fall asleep due to discomfort from muscle stiffness or rigidity. Anxiety about their health and future may also play a role in sleep difficulties. Furthermore, the frequent need to use the bathroom at night, a condition known as nocturia, can interrupt sleep and make it hard to return to sleep once awake. Excessive daytime sleepiness is yet another sleep-related symptom. Despite feeling extremely tired during the day, those with Parkinson's might still find it hard to take restful naps. This can lead to a frustrating cycle of fatigue that affects concentration and engagement in daily activities. Addressing sleep problems in Parkinson's involves a multifaceted approach. Medical treatments may include medications to help manage symptoms that interfere with sleep, such as muscle rigidity or depression. Lifestyle adjustments, like establishing a regular bedtime routine, creating a comfortable sleep environment, and using relaxation techniques can also help. Consultation with a sleep specialist might be recommended to tailor interventions and potentially conduct sleep studies for more personalized management strategies. Recognizing and treating sleep disturbances early can significantly improve an individual's daily life and provide much-needed relief. Symptom number 10, constipation and digestive issues. Constipation and digestive issues are frequently experienced by individuals with Parkinson's disease, significantly affecting their quality of life. These symptoms are primarily due to the general slowing down of the digestive system, a condition known as gastrointestinal dysmotility, which is common in Parkinson's. The slow digestion in Parkinson's can lead to constipation, which is one of the most common gastrointestinal symptoms of the disease. The movement of food through the digestive tract slows considerably, which means waste moves more slowly through the colon. As a result, the colon absorbs more water from the waste, which can make stools hard and difficult to pass. This can cause significant discomfort, bloating, and a sensation of fullness that is both uncomfortable and distressing. Moreover, this slowdown in the digestive process can lead to other bowel issues, such as an urgent need to defecate or, conversely, the inability to do so without straining. Straining can exacerbate other health issues like hemorrhoids or hernias and increase discomfort. The chronic nature of these symptoms can lead to a reluctance to eat or fear of eating certain foods, potentially resulting in nutritional deficiencies and weight loss. Managing these symptoms often involves dietary adjustments, such as increasing the intake of fiber and fluids to help soften stools and promote more regular bowel movements. Physical activity is also encouraged, as it can help stimulate digestive motility. In more severe cases, over-the-counter or prescription medications might be necessary to help regulate bowel movements. Being aware of early Parkinson's symptoms like tremors, slowed movement, and sleep disturbances is crucial for timely intervention. If you recognize these signs, consult a healthcare professional for a diagnosis and management options. For more resources and support groups, visit reputable health websites and local community centers. Don't forget to like, share, and subscribe for more health insights. Share your experiences or questions about Parkinson's in the comments below to help others in our community.